Good morning. Are you a pain in the butt, or do you have a pain in the butt? It's Lori Hoy here, and I am a mom, a wife, a fitness instructor, a quarter force instructor. Haven't had my first class yet, though. However, I'm a teacher, and I'm also someone who likes to investigate alternative ways of healing my body. For one, food, and for two, if I have aches and pains, I don't necessarily always pop a pill or go to my doctor and say, I have this. What else could I do? So I do massage, and I also see a physical therapist every once in a while, and my chiropractor. And today we're going to be talking about how to get rid of sciatic pain. I had a couple clients just in the last couple days that were suffering, and so I called her up and I said, hey, how about we do a live about ways we can treat that particular pain? And this is Dr. Fawn. Hi, Dr. Fawn. How are you today?
I'm good. How are you?
I'm doing well. So she's going to share with us a couple things to give you some education about sciatic pain. So if you are a sufferer of sciatic pain or somebody that you know, please either tag them in the comments, share the video with them, and maybe this will help them out. So take it away.
Well, first of all, a lot of people don't even really realize what their sciatic nerve is. Your sciatic nerve is the biggest nerve in your body. It extends from your lower back here in your spine, and it comes out right here, if you can see it, in the middle of your butt muscles, and it goes right down all the way into your leg and your foot. So sciatic nerve pain can present in a couple different ways. It can be the burning, aching pain that people get in their lower back that goes into their butt and their leg. It can be tingling and numbness. It can even cause some muscle cramps and muscle spasms in your butt or your leg. And it gets aggravated by a bunch of different things. Bending, twisting, lifting are the most common ways that people bend over and they get up and then they just know something happened. But more often than not, it's everyday life, little by little. Things can get aggravated, like sitting on it all day long at a desk job, because it comes right out of your butt, so you sit on it all day long. So lots of things can get it aggravated, but once it's mad, a lot of people have a lot of problems with it. So I see sciatic nerve problems in my office every single day, and so I'll skip the whole reason that an adjustment will help, because that's obviously what I do every day for it. But no matter what, after I adjust my patients, I always give them the same two things to do at home that will help it, because there are two components of sciatic nerve pain. There's always, always, always inflammation somewhere in the lower back joints and the pelvic joints that aggravates that nerve, and that's what causes the pain to shoot down into your leg. And there's also always really tight muscles associated when that gets mad. So I always tell people that the first thing they have to do is ice. Ice gets rid of inflammation. So you usually want to do it right at the lower part of your back. Sciatic nerve pain is usually on one side or the other. It can be both sides sometimes, but more often than not, you'll notice it primarily on one side. So I always say ice it for 20 minutes. Right at that little bump at the top of your butt that you feel, that's usually where it comes from. So 20 minutes of ice. As long as you leave it off for an hour in between, you can ice it as much as you want to. But I say at least 3 times a day. I tell people to do it in the morning and at night for sure. But if you're going to work out, like everybody who's in Lori's group should be doing every day.
Yes.
You want to do it right after your workout too, because that's where everything that you do really gets it inflamed. So, and just a side note about working out as well. Be careful, like if you've really got it flared up, you know, there's a difference between doing an exercise that, oh, this is hurt, this is sore because I haven't done this, versus, ouch, this hurts, I shouldn't be probably doing this move. So don't be afraid if you've got this flared up to skip that move or modify it or do something different so that you're not really taking it off. Because I tell everybody, as much as we were trying to get through these programs and give it our all, sometimes a couple days off now prevents a lot of time off later if you hurt it really bad in the future. So that's just my exercise.
That's right.
So
that's a good one.
Definitely ice, 20 minutes at a time. But then there are a lot of really, really tight muscles in here that really put a lot of pressure on that sciatic nerve when it's mad. So I'm going to show you. Lori's going to be my model here in a second.
Woohoo! First time I've ever been a model. Okay, I love it.
3 really simple stretches that you can actually do every day that don't take a lot of time, but they do a lot of good to keep the pressure off that sciatic nerve.
All right, awesome. So I'm gonna sit you down here. And Dr. Fawn, we've also talked a lot about nutrition, and some of the things that we eat can make that inflamed even more, correct?
Absolutely.
Yeah.
I have a lot of patients that, sometimes you really hurt yourself and you're just inflamed from that one moment, but more often than not, people that have chronic lower back problems that just keep recurring, I actually have talked to my patients a lot about the nutrition as well, and that when you cut out inflammatory foods, which are sugar, dairy, grains, when you cut that stuff out, it really helps to decrease all the chronic pains that you have a lot of times.
And you can't just cut it out for like a day.
Exactly.
You have to do it over a period of time. Where, start out with a week and then build on from that.
Exactly.
Yeah.
And then what a lot of my patients do is they will cut it out and they'll say, oh, I feel so great. And then they'll have a bad weekend and they'll say, oh. I ate this and now my back hurts again. And that just teaches them that that's why they shouldn't eat it.
Kind of like a brownie sundae on a birthday. Yeah. Okay.
Yeah.
Anyway, back to this.
So 3 really simple stretches. They take 2.5 minutes each. What we're going to have you do is we're going to have you lay on your back.
Okay.
So the first stretch is you're going to bring the one knee up, and you're going to grab it with both hands, and you're going to drop your flip-flops. So what you're going to do is you're going to hold this stretch for about 30 seconds. You're going to come up as far as you can comfortably. If it hurts, you don't have to be a hero. Don't pull to where it's really, really painful.
So even if I would pull it to here, if I knew if it hurt really bad, if I just pulled it to here, that would be okay.
Absolutely, yep.
Just as long as you're stretching it out.
Some people, like if you have a bad knee, you want to make sure you can grab underneath here so you're not pulling on your knee and giving yourself a knee problem.
Okay.
But some people can't even reach their knee when they're in this much pain. So what you can do is you can put a towel or a belt under your leg and pull up like that. So nice and easy, 30 seconds with this leg, and then you repeat with the other side for 30 seconds. So that's 1 minute, that's easy enough. Then you come back and you grab the first leg again, just like you did. Now on your way up, you might experience some pain, but once it's up here, it should be pretty pain-free. Like just using the muscles to get up, it's normal sometimes that it's sore, but as long as you're here and it's not painful, then that's fine. But now, so you're gonna do the same thing that you did the first time, only this time you're gonna pull your knee that way, towards your opposite shoulder.
Okay.
Now that's going to pull down right in her butt, and that
feels good.
Right where your sciatic nerve comes out. So if you're actually having a flare-up, you might have some burning down your leg, but like I said, don't be a hero. Don't make it really bad. Just feel a nice gentle stretch, 30 seconds to this side, and then you bring this leg up, and 30 seconds to this side. Now, the other thing too, if you're only having a problem on one side, you should still stretch both sides because you don't want to create a problem on the other side by not keeping it as loose as possible too. So 30 seconds again. So all total so far, we've got 2 total minutes. The last stretch is you're going to bend both knees, put your feet flat, and all you're going to do from here is gently rock back and forth. Go about 10 times to each side, takes about another 30 seconds. Now this one, you want to go as far as you can comfortably without rocking your shoulders off. So she's going to keep her shoulders flat on the table or the bed or the floor, wherever you're doing these. And that is your last stretch. 2.5 minutes total. I tell everybody to do these right when they get in bed at night because that way you're just stretching everything out that you've jammed up during the day. Right when you get out of bed, and again, right after you work out.
So I can stop.
Now you can do them, you can go ahead and sit down, okay? You can do them on the floor, you can do them on the bed. I just know that from somebody who I myself have had back problems, when your back really hurts, you might not want to get on the floor because sometimes getting back up is hard. So bed is fine, floor is fine. Drop it in your office if you're working and you need a place to stretch. But
so for those of you out there that are struggling with a little bit of back pain, try these exercises. 2.5 minutes. Everybody can find 2.5 minutes to feel a little bit better. Dr. Fawn, tell everybody where they can find you and where you're located so that if they want, are experiencing some more pain, that they maybe come visit you.
I am located in Macklehattan. I'm right across from the urgent care in Macklehattan, 565 Macklehattan Drive. We have lots of stuff here that can help you. We have not only chiropractic adjustments, we have massage, we have a new salt room that helps with all sorts of different ailments.
Salt room is awesome. I love it.
And I'm all the time, you can find us on Facebook under Fresh Start Chiropractic and ask me questions if you have more that you want to know about this. But for right now, these are the best 2 things you can do. Ice and stretch, and it'll stop a lot of that sciatic nerve pain.
Awesome. All right. Okay, guys, there you have it. If you have a pain in the butt in your life, share the video. Talk to you soon.